Hi guys, welcome back to Biolog. Hope you're having a great day and a great week. Today's topic is going to be misused drugs or recreational drugs. By the end of this video, you should be learning about the idea of narcotics, smoking, chronic obstructive pulmonary disease, and chronic bronchitis. Now we'll be discussing about emphysema and how heroin affects the nervous system in the next couple of videos. So do make sure you subscribe to Biolog and hit that notification bell so you don't miss on any uploads. With that being said, let's just get right onto the video. Narcotics. Narcotics are divided into three types, mainly heroin, morphine, and codeine. Heroin, morphine, and codeine are made from opium, and specifically heroin is made from opium poppy seeds. These three drugs are known as depressants because they give the victim a sense of relief from anxiety or stress. They produce short-lived feelings of well-being and freedom from anxiety, and thus can lead to tolerance and physical dependence. So the victim experiences physical dependence on the drug, and so when they try to give up the drug, they experience withdrawal symptoms which are known as cold turkey. Hepatitis. This is an inflammatory condition of the liver which mainly occurs because of an overdose of the drug or drug abuse, or rather an overdose of alcohol as well. Morphine is a more effective analgesic. Analgesic is a drug that is taken to relieve pain than codeine. So rather we can say that morphine is more effective in relieving pain for the victim than codeine. Alcohol usage. Now, even a small amount of alcohol that enters the blood increases the person's reaction time. The reaction time is the interval or the time taken between the recovering or rather receiving the stimulus. Let's change that right here. The time taken between receiving the stimulus and rather responding to the stimulus. Yeah. Now, vasoconstriction and vasodilation. So the difference between vasoconstriction and vasodilation is that vasoconstriction is where you have the narrowing of the blood vessels to prevent heat loss. Vasodilation is where the blood vessels are relaxed, and this causes increased blood flow, which actually allows the organism to release heat to the surroundings. Now, the contradictory idea of alcohol is that alcohol actually causes vasodilation, but the person who is drinking the alcohol feels a sense of warmth. So you feel a sense of warmth, but you're actually losing heat to the surroundings. Effects of alcohol on the liver. The liver considers alcohol as a toxin that detoxifies 90% of its contents. So the alcohol is oxidized to carbon dioxide and water. When the alcohol intake is more than the rate of oxidation or more than the capacity by which the liver can break down the alcohol, it leads to intoxication, which is basically the build-up of alcohol in the blood. Now, lots of alcohol can lead to the accumulation of fat droplets in the liver that causes cirrhosis. A cirrhotic liver is unable to oxidize the toxins and thus unable to stop the poisonous substances from escaping the intestinal blood and entering the general circulation of the body. Smoking. Now, this is a common problem that is generally seen in the public. What does smoking do? Its effects on health. Now, cigarette smoke rather, contains carcinogenic substances. Carcinogenic substances are the substances that cause cancer. These substances are like carbon monoxide, tar, and nicotine, which is the most addictive drug. Tar is a sticky black substance present in cigarette smoke that paralyzes the cilia, or rather prevents it or stops it from beating entirely. Now, when the cilia is stopped from beating, it is not able to move the mucus up the throat and into the nose so that it can be expelled. Now, when it doesn't beat, the mucus does not go out of the body. So, there is a buildup of mucus in the respiratory tract lining. There are two types of smokers. One, who actively smoke, and two, passive smokers. Both active smoking and passive smoking have the same effects. Lung cancer and chronic obstructive pulmonary disease. Now, cancer is a term used to identify abnormal cell growth in the body that causes formation of tumors. Specifically, you have two types of tumors. In a body, you have benign tumor and malignant tumor. A malignant tumor is an abnormal growth in your body which is actually a cancerous tumor. but a benign tumor is just a regular tumor in the body. So every tumor or every cell has this substance called MHC1. It's called major histocompatibility complex. So every normal cell has major histocompatibility complex, but a cancer cell is an abnormal growth, so it does not have this MHC1. So that's why when we say it's malignant tumor, it does not have the MHC1 compound. A chemical that causes cancer is called a carcinogen. Chronic obstructive pulmonary disease again covers a number of other diseases, which are emphysema and bronchitis as well. Now, people with chronic obstructive pulmonary disease will experience difficulty breathing because the bronchioles become narrow, and this causes the cough to occur and build up of phlegm to occur as well. Performance enhancing hormones. We are coming to the end or the last segment of the video. We'll talk about performance enhancing hormones in this case. So these hormones are broadly classified into two: testosterone and anabolic steroids. Testosterone is made in the male testes and is responsible for promoting male primary and secondary sexual characters. The increase in testosterone causes the vocal folds to mature, causing an Adam's apple, which is generally seen on the neck region in men. Now, in this case, you have these hormones that build up, or rather enhance your performance, especially for people who are runners or athletes. They take this testosterone to increase their body mass or their muscle mass so that it enhances their performance. The next type is anabolic steroids. Anabolic steroids are the synthetic derivatives of testosterone. They affect protein metabolism that increases the muscle development. Effects of taking anabolic steroids are sterility, masculinity in women. So this is masculinity. Masculinity in women, as well as liver and kidney malfunction. Alright, that'll be all for today's video. Hope you enjoyed the video. Please like, share and subscribe to Biolog, and I will see you in the next video. Bye. Have a great day.